Xanthelasma palpebra. Xanthelasma palpebrarum are the yellow plaques that can appear on your eyelids. Xanthelasma palpebrarum most commonly start in the corners of your eyelids and grow out from there. When they first show up, they will appear small and unobtrusive, but over time Xanthelasma palpebrarum will commonly expand, making their presence known when you look in the mirror. Sometimes xanthelasma settles down and you will have years of looking at that one little annoying yellow lump, but to be honest, most of the time, they will make you think they have calmed down and then burst into life and start growing with vigor. They are known as eyelid plaques or xanthelasma, but to put a medical edge on them, they like to go by the name of Xanthelasma palpebrarum. It is the most prevalent of the xanthomas family, with asymptomatic, symmetrical, bilateral, soft yellow, velvety, polygonal papules around the eyelids. They range in size from 2 to 30 mm and are flat-surfaced, and have distinct borders edges. For the client with the Xanthelasma palpebrarum, they are thankfully not itchy or painful, but once present, Xanthelasma palpebrarum don't usually go away on their own. In fact, the plaques frequently grow larger and more numerous. They are foamy in nature and classed as a cutaneous necrobiotic disorder. Xanthelasma palpebrarum and lipids. With every patient with Xanthelasma palpebrarum, they all have underlying lipid abnormalities. Xanthelasma palpebrarum may occur without any underlying medical condition though. It is not necessarily associated with elevated cholesterol or lipids. Getting good control of your blood lipids, including triglycerides and cholesterol levels, may help reduce development of xanthomas overall. Having your blood lipids tested is a great way to better understanding what is going on with your lipids and why a disorder may be occurring. Xanthelasma palpebrarum clinical overview. As the xanthelasma definition implies, it can happen in a number of hereditary disorders of lipoprotein metabolism, including homozygous and heterozygous familial hypercholesterolemia, familial dysbeta-lipoproteinemia, type 3, and in systemic disease. What is the reason for the surface plaque exposure? Many times it is the lipid that is at the root of this disorder, as is evident by the xanthelasma definition. There may be good proof that the lipid found within xanthomas is the same lipid circulating in high concentrations in the plasma of patients. However, the precise mechanisms that result in xanthoma development are less clear. It's been proven that scavenger receptors for low-density lipoprotein, LDL, present on macrophages can take up lipid. This converts them into foam skin cells. It has additionally been proven that extravasated lipid can produce foam skin cells by inducing vascular endothelial receptors. Furthermore, oxidized low-density lipoprotein has been proven to be involved in the creation and infiltration of foam skin cells within the dermis. Local factors like temperature, activity, and friction may increase LDL leakage from capillaries. This further aggravates the condition. Systemic implications and complications. The basic xanthelasma definition should allow the clinician to check for complications of hyperlipidemia. These patients should be screened for lipid abnormalities and also have vigilant treatment of their lipid derangement to decrease the development of atherosclerotic disease. This is necessary to reduce the vascular and in turn heart, thrombotic, clotting and organ complications of deranged lipid levels. Xanthelasma under the microscope. The hallmark histopathologic feature of most xanthomas is the occurrence of foam skin cells within the dermis. These skin cells represent macrophages that have accumulated lipid. These skin cells will stain positive for lipid with special staining. According to the location of the plaque and the specific location of the foam cells, a histologic specimen of xanthelasma can contain striated muscle, hairs or just epidermis. If you have been diagnosed with altered lipoprotein composition or structure, such as lowered high-density lipoprotein, HDL, levels or type 2 hyperlipidemia and the type 4 phenotype, you are more likely to suffer from xanthelasma. Find out more about how to easily remove them with Xanthel, the Xanthelasma and Xanthoma Removal Cream.